Hi, today on the Let's Talk Thyroid podcast, I'm talking with Angela Brown. You're going to love this conversation. I was re-listening to it, obviously, as I'm editing it, and oh my gosh, there's so many gems. Angela weaves in her both personal experience with having hyperthyroidism and her professional experience as a holistic health coach. And she's also a functional diagnostic nutrition practitioner. Really likes to dive into advanced testing and thyroid healing for women. And so she really uses her own experience and expertise to work with other women with thyroid issues. And we dive into this, I guess, the testing and different ways of testing, particularly talking about minerals. So we chat about things like calcium and potassium, selenium, those types of minerals that are really important for thyroid health, not to have too much or not enough of. So we talk about that. We also really cover a lot about mindset and how important mindset is to having a healthy thyroid. So I hope you really enjoy this conversation with Angela. Don't forget to hit subscribe and share the episode with any friend that you might have that has a thyroid issue. Before we get into the show today, I just want to say to those of you that are feeling overwhelmed and not too sure where to start with tackling your thyroid health from that diet and lifestyle point of view, then why not consider doing a strategy session with me? We can spend an hour together just trying to cut through all of the different information and work out what's the next best step for you, just to simplify it and get you started on a road to feeling better. So head to annabellebateman.com/strategy. I would love to do a session with you and just really help you get started. Hi, and welcome to the Let's Talk Thyroid podcast, where we discuss different aspects of living a healthy thyroid lifestyle, positively and practically, so that you can really thrive and not just survive. So join me, your host, Annabelle Bateman, and let's talk thyroid. Okay, so Angela, welcome to the Let's Talk Thyroid podcast. I'm really thrilled to have you here to share your story and share your wisdom with us.
Yeah, thank you so much for having me. I'm excited.
Yeah, so we just connected over Instagram, which I'm finding is a really fabulous way to connect with other thyroid warriors around the world. Have you found that?
Yeah, it's funny that you say that. I was just talking to someone recently about how there's so much information on Instagram now, especially with Thyroid World. There's a lot of good, juicy information on Instagram, and it's awesome to see all the coaches and all the people interacting on there with it.
Yeah, there's lots of generous information, it's been really nice. I've just enjoyed connecting with different people and having them on the show and getting to know them. I feel like I'm making all these little thyroid friends all around the world.
Yep. That's exactly how I feel.
Yeah. So welcome to my world, and I'm looking forward to being.
Yeah, me too.
Tell us a little bit about you first, and then we might launch into your thyroid story.
Sure. So I am a functional diagnostic nutrition practitioner. I actually started in the healthcare field. I started as a physical therapist. That's what I graduated with a degree in.
Okay.
In my early 20s, and I started that, and I don't know, it was just weird. And I don't know if it's because I struggle with hypothyroidism myself, but I started seeing all these, particularly women who were having all these other health issues besides physical therapy issues. And there was always this consistent complaint about not feeling good, having all these other health issues, but didn't know what to do with it. And over the years, I started feeling like, I think I want to go further into health coaching, not just doing physical therapy. I loved it, but I wanted to expand on that. And so that's why I got certified in functional diagnostic nutrition practitioner, so I can utilize lab testing, things like that, to really dive further and customize in the clients that I work with. And then I really honed in on thyroid stuff since I struggle with it myself. It's been such a really, really fun avenue, and working with these women and seeing them progress and being able to coach them all along the way, because I've struggled with it myself.
Yeah. I think when we've struggled, we know how bad we can feel, but also that we can feel better. And so you sort of see people struggling and think, no, you can feel better. Like it's this up and down road. But
it is an up and down road. And even,
yeah.
you know, when you do get better, there's still, I mean, whenever you struggle with anything with your thyroid, it is a lot of up and down.
Yep. Yep, for sure.
Yep.
So tell us, I want to come back into all the professional stuff and the way you work with clients, because I think
Yeah.
you've got some really interesting information to share with us. But for you, like, when were you first diagnosed with your
Sure.
Hashimoto's? And
So I I got diagnosed when I was 22.
yep,
I
me too.
actually, yeah, and I thought you had too. I thought it was the same story.
Yep.
So I got diagnosed then, and it was kind of weird because I was in college for a physical therapy program, which was really intense. It was very hard. I was stressed out a lot, and I just assumed it was just stress. Every doctor told me it was just stress. And it took a couple different doctors to get the diagnosis of hypothyroidism. And then, oh man, it was a pretty long struggle. It was probably another 12 years of different doctors saying the same thing, essentially. Here's another pill. Sometimes it's all in your head. Things like that, I was like, there has to be a better way. This cannot be just the way it is. And I was essentially only ever put on medication like Synthroid. It was all I was ever put on. And I never felt good. Nothing ever was making me feel good. It was just such a long battle, to the point that it took 7 doctors to finally get to a functional medicine doctor. Yeah, that was like, you actually do have hypothyroidism. I'm like, I know I do, but no one's really helping me get into like, what else is causing this, and why is this medication not working? So that long battle is what really fueled me to like, I want to get some sort of certification so I can start not only, working with clients, but I wanted to work on myself. I'm like, I have to get to some answers here because this is not working. And that diagnosis, it was tough because when I got diagnosed, it's like I put this label on myself. I have hypothyroidism. And I used that as everything going wrong. Oh, it's my hypothyroidism, but I wasn't getting any help. So that's why I was like, there has to be a better way. There has to be a better way at this.
Yeah. So have you got Hashimoto's as well, or?
No.
Okay. Right. I think I had that.
I was having this discussion actually with my husband because I just got my thyroid labs back. I get them checked every year now. And I'm like, I don't have antibodies. I'm like doing a happy dance that I don't have antibodies. I did have antibodies at one point when my thyroid was totally tanked because I was going through a really stressful event for about a year and a half-ish. And they were really, really low. And then I've never had them since. They never did with it. Never said, you know what? They were like, I think it's a stress response. Not sure on that. But I haven't had any since then. But
well, that's good.
It's.
And when you're doing a happy dance, that's good.
Yeah. And but I still get them checked because I'm always like, well, if I had them once, I could have them again. So I still get them checked every year.
Yeah. So can you just explain while we're talking about this? Because I think you did this in an Instagram post recently, the difference between hyperthyroidism and Hashimoto's, because I'll leave that one to you.
Yeah. So Hashimoto's is essentially a type of hypothyroidism. So hypothyroidism is slow thyroid. The thyroid is not functioning optimally. And Hashimoto's is also slow thyroid. But the difference with being straight hypothyroidism and Hashimoto's is an autoimmune response. So essentially your body thinks that your thyroid is a foreign object. It attacks it. It's just an immune response. It starts attacking it and it literally starts like killing pieces off of the actual thyroid. It attacks it and it can get pretty severe for some people. And then straight hypothyroidism is not an autoimmune response. It is your thyroid hormones aren't working. Your thyroid is not working. It is a straight non-autoimmune response. So that's why I actually did a post on that, because people aren't really told the difference when they get diagnosed. And the treatment and how you work on that, there's some similarities, but there are a lot of differences. And autoimmune, the way you respond to an autoimmune treatment for something like Hashimoto's is very different than just straight hypothyroidism. And so many are not told that when they get diagnosed.
Well, I mean, you would probably have a better understanding of this, but my understanding is just from talking to people is that so many people with Hashimoto's are never told they actually have Hashimoto's.
Right. That's the other thing.
They just say, you've got an underactive thyroid, take this pill, off you go, come back in 12 months for a test. I was talking to someone not that long ago, and she's like, I said, well, have you got Hashimoto's?
They don't even know.
I don't know. And I'm like, what do you mean you don't know? but they don't know. So, and if
well, and that a lot of it is they don't know. One, the doctor either doesn't tell them that, or they're never tested. So many people are never tested for thyroid antibodies, so they don't even know they have Hashimoto's. And anyone that comes to work with me, I'm like, okay, first of all, full blood panel for your thyroid. I need to see if you have antibodies. I need to see, because we are going to attack this a little bit differently if there are antibodies present. And a lot of them are like, I've never heard of that. The doctor's never told me. So, which is kind of sad.
Well, it is. And so, I mean, do you find just anecdotally in your, with your clients, is there do most have the autoimmune? Yeah. Right. Okay.
Yeah. I mean, I would say 90% of the women that I work with, they have Hashimoto's.
Yeah.
The majority of them do. And unfortunately, the majority of them not only have it, they don't know it until I'm like, you have to get this blood panel. And then we get the thyroid antibodies back. And they're like, my doctor never would have checked that. I would have never known.
It's the same in Australia. It's no different.
Yeah. And I figured.
It's really not. You've got to push for it. You've got to ask for it.
You have to.
I know our medical systems are quite different, but even here, like I can get that all the blood tests I don't pay for. Like they're all under what we call Medicare.
Yeah.
But until my general understanding, and it will vary from doctor to doctor and case by case, but until you've been diagnosed with Hashimoto's, they won't cover the antibody test.
Yeah, so I believe that.
It's not that expensive to get it done. So I often say to people, just offer to pay, because you have to get that.
Well, that's essentially what I end up telling my clients. I'm like, because if the doctor orders it here in the States, if the doctor orders it, the insurance typically will cover it. But now you can order lab testing yourself here. I mean, they have at-home test kits where you can do a finger prick, send it off, and it's so cheap. I'm like, just do it.
Wow.
Let's figure it out. Just do it. Because one of the issues we have here is a lot of times it's like pulling teeth to get a doctor to actually order a full thyroid panel. Mm-hmm. Yep. So I'm like, we're going to do it ourselves then, because you have to do it. We have to see it.
Yeah. Yeah. And so, well, let's just keep on this topic. I'll come back. I'm going to ask you a few more questions about your story. But so someone comes to you and they're like you, straight hyperthyroidism, no autoimmune component. Mm-hmm. What's the main difference in the way you approach how they're managing their thyroid health?
So when it comes to and we're talking about like Hashimoto's, lifestyle, diet, things like that. I mean, they're important for both, but it's a pretty much non-negotiable when it comes to Hashimoto's. Like, no question. We have to take gluten out. A lot of times they have to take dairy out. That is essentially, it is like a non-negotiable. Like diet is absolutely non-negotiable. There is no way around it. We have to work on all the things that could be creating havoc to increase an autoimmune response, or inflammation, things like that. So the big difference is I make it's almost like I said, it's like a non-negotiable.
It's more mandatory.
It's more mandatory. Yeah. And I emphasize it when it comes to someone who's straight hypothyroid. It's an emphasis, but we can make it less emphasis. One thing that I do find is a lot of the women that come to me, they're so stressed out already. They're overwhelmed, they're frustrated, they're sad, they're depressed, all these things. And the overwhelm is too much. So if I throw too much on them at once and bombard them, they can't handle it. Yeah. So I have, when people work with me one-on-one, we do steps with it. So I don't throw all my information on them on the first day. We just tack on different modules and steps as we go along. And the reason I do that, one, is I don't want to overwhelm them, and I want them to actually work on the task at hand. So they get action tasks along the way. Well, someone with Hashimoto's, I'm going to bump that like lifestyle, eating, things like that. That's going to be right in the beginning. We're going to hit it right away in the beginning. And then because those people, I find that even if they're overwhelmed, we have to hit it. Like they don't get a choice in that. And then if they don't have Hashimoto's, if I know that from the get-go that they do not have Hashimoto's, then I might be a little bit more like lenient on, okay, let's get mindset going here first. Then we're going to tack this on. So it's more of an approach of what I feel, like I said, non-negotiables or mandatory. I'm going to kind of adjust it, how I do that. Depending on what I see with test results, supplementary, I might change what I do with them as well. There's, again, with autoimmune response, I mean, you have like leaky gut and all these other things that are typically happening. So I'm usually going to have to really hone in on gut health so much faster than I would on someone with straight hypothyroidism.
Yeah, that's really helpful because I think a lot of what I talk about, because I'm not medically trained, I'm coming at all of this from a pretty well-informed patient perspective.
Oh, you're very informed.
I've done a lot of,
yes,
I think like you, I was diagnosed at 22. I'm now 40, nearly 47. I think I've lived my whole life with it, but I've done a huge amount of reading, research, blah, blah, all of that. Yeah. But I suppose, I used to be a lawyer, so I'm pretty careful around, well, I try to be careful around not crossing over into areas that genuinely aren't my expertise. So
I see
really my focus is on all of that diet lifestyle stuff because it's so important. And
it's huge.
Go get you. And it works so perfectly in conjunction with the medical approach. And so like I'm on medication. I've been on it since I was 22. And I often say I'd be dead if I didn't take my medication.
Yeah. 100%.
But if that's all I did, I'd be miserable.
Right. Right. And that's the difference. And so I do get a lot of clients that say, bummer, you still have to take thyroid medication. I'm like, not bummer. Happy that I still have to take thyroid medication, because if I didn't have that, I wouldn't be able to function. But it's not just I always tell my clients, the medication for a lot of people, it can be a Band-Aid. So don't Band-Aid it. You have to do all the other things so that medication actually works. That medication will not be as effective if you're not doing all the things to help your body. And so lifestyle, diet, all those things, those are huge factors. If you want your medication to actually work, you probably need to do the other things then.
Yeah, and particularly if you're taking I think you call it Synthroid, we call it a Roxen, your standard T4 replacement.
Right.
You have to have your gut
working,
liver working, and or you're never going to get any T3, are you?
No, you're going to get zero conversion. Absolutely, you'll get nothing, and that's a whole another
conversation.
We really go into that with all the things that can affect conversion, because a lot of people are on T4 only medication, and that's a huge discussion. And people, again, it's another topic. They're not told that. A lot of people don't even know what T3 is. They only know what Synthroid, levothyroxine, all these things. They're like, well, I don't even know what you're talking about. When I talk about T3, they're like, what is that? Because the doctors never talked about that. They're always talk about T4, so they don't know about thyroid hormone conversion, all those things. And that's a huge factor that can be affected. If you're only taking T4 and your gut is terrible and you have horrible liver health, you're not going to convert.
Yeah. Have you tried, I've tried lots of the different medications over the years. Have you?
Yeah. So I was put on Synthroid in the beginning. Never worked. I just could not. I never felt good on it. And then at that time, when I finally found a functional medicine doctor, they put me on WP thyroid. Now that, I don't know, that went on back order. Okay. Not long after I got put on it. It was barely on the market. It actually worked wonders. And it went on back order and it never came back. So then I was on Armor.
That's your like desiccated thyroid?
It's desiccated thyroid, and it worked for a little while for me, not 100%, but my levels were always goofy because Armor is T4 and T3, and the Armor was like set at like different strengths for the T3 and T4 in each pill, and mine were always, the T4 and T3 never jived. So I ended up getting my, and I was really sensitive to the fillers a lot of times and medications, not just with thyroid medication. I was very sensitive to any medication. So now I have my, and I started this years ago, I have my medication compounded.
Yeah.
So I get the exact T3, the exact T4 that I need, not really any fillers. So I don't have to worry about the sensitivity thing. And that's been working for me. And I was on a very high dose when I started, and now I'm on a minimal dose.
Yeah. Wow.
Yeah. So, but it was a
It's a lot of playing around, isn't it?
Playing around with it. And that's
a long period of time.
Over a long period of time. And that's what I always tell people. I'm like, just keep in mind, the ones that are on thyroid medication, I'm like, thyroid medication is tricky. It doesn't happen overnight. It can take years. It took years for me to find that medication dosage, all that of how it works for you. And it is not a cookie cutter approach. I always tell my clients that just because your friend is doing it or your cousin or your sister is doing this medication does not mean it's going to work for you. It is not a cookie cutter approach.
Yeah. Yeah. I know that's sort of been my experience too. Like I started on the Eroxin. I've ended up back on it actually.
Which is good.
I mean, I've never been off it. I've never been off medication, but I have tried, the slow release. I've tried all sorts of different things.
All of it.
And basically, it's not that the others didn't work. It's just that they didn't work well enough to justify the cost of them.
I know.
They're really expensive. At least with the Eroxin, it's cheap.
It's cheap, right.
As long as it's working. I'm not just only do that because it's cheap. But the others just, for me, at those points in time, they weren't good enough, They weren't like that amazing kind of response that some people get. So I think I've just done a lot of work on working on gut health, health, on, some of those.
And that is exactly why I always say that. I'm like, all the other things. And you could be taking all the thyroid medication in the world, like my compounded still, even though it's T4, T3, it still would not be working if I didn't always make sure my gut health was okay, my liver health, all the things. You still have to work on all that.
Yeah. So, Angela, when you were diagnosed at 22, like, do you think it was that kind of college stress that triggered it, or like, can you look back and think, how have you kind of reflected back and worked out for you?
I would say, I probably had hypothyroidism like even before college, because even in high school, it was weight was a struggle, energy, and I was involved in a lot of sports, but I could I would crash and burn very easily. And weight was always a huge issue for me, up and down, up and down, up and down all the time. And I was just exhausted all the time. And then I was like, oh, let's go to college and let's do a physical therapy program that's even more stressful.
Yeah, because I think we call that physiotherapy. I mean, I know
same thing.
Physiotherapy, and it's a really tough degree. I mean,
it was tough. And I was like, that's great. So now I'm stressed out even more. And I think the going to college and all that stress was kind of the straw that the camel's back. I think that just was like, okay, this is it. And I did get to the point where it was like I couldn't stay awake for anything. And I graduated, got my licensure, all that stuff. And then I was in the real world with work, and I'm like, I can't even stay awake at work. How am I going to enter the real world? I can't do anything. And then again, it took a couple of doctors to actually get diagnosed. Crazy, but the doctor that I was seeing at the time when I graduated from PT school and pretty much knew it was thyroid stuff, would not test me for anything. Said that's not slow thyroid. You just, you're just getting older. I was 21 at the time.
Oh, wow.
Getting older. I'm 21 years old. And then he went on to say, does anyone in your family enter menopause at an early age? I'm like, 21, I'm not entering menopause. So that was the last time I saw that doctor.
Wow.
But again, it took a couple of doctors to get the diagnosis. And then
so that was just you trusting your intuition that something's not right. Yeah. So that's pretty tenacious for a 20, someone in their early 20s.
Yeah. And probably some of that was because having been kind of in the medical field, I worked with a lot of doctors, orthopedic surgeons, things like that at that time. And I mean, they were like adamant, with their patients or whatever. If you don't feel like you're getting good, and we dealt with it in the physical therapy world. Like if they didn't like their physical therapy, those doctors were on it. So it was like, I see in the medical field how this works. Like if you don't feel like you're getting the correct treatment, the correct care, you have to stand up for yourself. And so seeing it day in and day out with patients, I was like, I'm pretty sure that I know this is a thyroid thing. And then doing the research on it, I'm like, I know it is. I know it is. And no one would help me. So it took a little bit to get that.
Yeah. Yeah. And that's a really common story. So I think if you're listening and, that's what you're being told, just keep, so I say all the time, just keep digging. Keep finding out, trust your instincts.
Yeah.
Get the tests, see different doctors, don't give up.
Yeah.
But trust yourself, because it's so easy to then, maybe it is in my head, or maybe I am just lazy, or maybe I am just eating too much chocolate, or maybe I am not walking, and all that negative self-talk.
Yeah. Well, and that's the issue, what you just said right there. It's the negative self-talk. And the problem with that is you end up getting that ingrained. I mean, I did it. I was like, okay, well, none of these doctors are helping me. Maybe I am crazy. Maybe it is all in my head. Maybe it's just the way it's going to be for me. Like I have an identical twin sister, and she has the exact, she went through the exact same thing. And, and the doctor that diagnosed me at the time, I told him, I said, well, I have an identical twin sister. She's kind of struggling. I'm pretty positive she probably has the same thing. And he's like, oh yeah, no, that doesn't happen. So it was just like, when you hear things like that, I'm like, man, you really have to be pushy. You have to be diligent about your own health.
Yeah, because we do, and we should trust the medical profession. We should be able to.
Right.
And there are so many wonderful doctors that are incredible. Yeah. But in that, we've still got to trust ourselves. So it's that tension, isn't it?
Still have to trust it. Yeah, exactly. And your own body. Yeah. Yes, there are things that, maybe that's not there, but your own body. And if you feel it, you have to keep pushing.
Yeah. Yeah. So does your twin sister have hypothyroidism as well?
She does. Yep. She does.
Yeah, right.
Yeah. Yeah. And
how fascinating.
She got diagnosed probably close to around the same time that I did.
Well, she probably thankful for you and and you're pushing,
Yeah. Because I'm always pushing with that. Yeah.
Yeah, I know. I am too. My mum was diagnosed with Hashimoto's last year because I thought I was this genetic anomaly, and I know there's a genetic predisposition. No one in my family has it ever, And then mum was diagnosed last year.
You're like, oh, shocker, right?
And it all made sense. But I kept saying to my sister, just next time you're getting blood tests, get the full thyroid panel, make sure they test your antibodies. And so she just recently did, and no antibodies. It was all fine. I'm like, great. That's
You're like, good. Yeah.
Excellent. But, good on you for being tested, because it, runs in families.
Well, and especially when it does run in families. And that's why it's so important to not ignore, get tested, at least rule it out. And then if you don't have it, then you're good.
Yeah. Yeah, exactly. So one of the things that we had planned to talk about today, I'm sure we can talk about a whole range of different things, is something that I haven't really explored in detail with anyone, and that's minerals and mineral deficiencies, and how do minerals kind of serve the thyroid, don't serve the thyroid. So I think I've kind of delved into this. It's not something I know lots about, so I'm looking forward to learning a bit more.
Yeah. So this is an area that when I was really struggling with my thyroid, I was still on this roller coaster of going up and down quite a bit. And then I stumbled upon after I had got certified in functional diagnostic nutrition, something called hair tissue mineral analysis. And, and I was like, this is kind of interesting. It's kind of like there's a lot of things in here that could shed light on some thyroid stuff. So obviously interested in it myself, I thought I'm going to get certified. I'm going to test in this, and I'm going to do this stuff. What I learned with it was there is such a massive connection with thyroid that I had no clue, never heard of it, couldn't even believe that there was a connection. And that's essentially why every person that comes to me now for thyroid, they get this test. And that's why, because there's such a big connection. So one pattern that I see pretty commonly on almost on all the women that I work with when getting their hair tissue mineral analysis, is they actually have really elevated calcium. And unfortunately, obviously we need calcium, but calcium is supposed to be in your bone and your teeth. So there's essentially a level where you're supposed to have it in the hair. And a hair tissue mineral analysis gives me like a 3-month average. So that's why, getting a blood test with calcium, it's going to kind of give me the snapshot of now, like right now, that day. But I'd rather have a 3-month average. It's going to give me a better idea. So, because obviously minerals can fluctuate so much from day to day. So I would rather do it on a hair test. Well, calcium, like I said, it's supposed to be in bone and teeth. So when it's really elevated, if you think about calcium, it can calcify. One area that it really hammers is the thyroid. It will decrease the sensitivity of like thyroid hormone, of the thyroid cells. So I almost inevitably every single time I get a hair test back and it's someone that I'm suspecting is hypothyroid with or without a blood panel, their calcium's through the roof. And I obviously immediately I'm like, okay, we have to lower that calcium. Now, the hard part with calcium is it's not the smartest mineral. So once it gets out of the bone and teeth, it doesn't know how to go back. And so a lot of times you can have calcium overload like that for years and years and years of slowing your thyroid down and you don't know it. And like I said, it doesn't know how to go back. So you have to really be careful with how you get it to go back and diligent with it, because if that continues to do that, it can be hard for some to really correct what the thyroid's doing. The other thing that I also see is I will have some that come to me and I'm like, your thyroid panel actually looks pretty decent, your blood panel. So your thyroid hormones aren't terrible, but then their calcium's through the roof. So it's actually the calcium that's making their thyroid an issue, not the thyroid hormones. And that's why doctors will say, oh, your thyroid panel looks great. You have nothing wrong with your thyroid. And I'm like, no, you could still have some things slowing your thyroid down. It's just not showing up on a blood panel. And I see it. And now, does it happen all the time? Not always, but I see it very commonly where this will happen. Most of the women that come to me have gotten to the point where they're exhausted. So they're frustrated and they're like, okay, I actually do think that they have this blood panel where their thyroid is extremely slow on a blood panel in conjunction with that high calcium. What did you just ask me? You just asked me something.
Is the hair mineral analysis the best way to test if you've got high levels of calcium?
Yeah, essentially, like I said, you can check it on blood, but it's just going to tell me right now. I want to see a 3-month average. So yes, the only really way that I find is a much more accurate way to get that calcium read is in a hair tissue mineral analysis, because like what you ate the day before can affect your calcium levels on a blood panel. So like if you're constantly eating dairy and almonds that have a lot of calcium, that can affect that. So I'd rather see it on a hair test to give me a 3-month average.
And can you be deficient in your bones and teeth but still have high levels of calcium?
Yes, you can.
Okay.
It's hard to say. So essentially I've seen scenarios where they get bone density scans and things like that, and they're told, oh my gosh, your bone density scan looks really, really bad, but their hair tissue mineral analysis doesn't look bad for calcium in the hair. So it basically means that calcium's not going to the hair, essentially. It's going, if there's loss of calcium in the bone, it could be that the calcium that is coming out of the bone, they might just be excreting it. They might just be it might be going right through their liver, whatever, and excreting it. So I have seen that where it happens that way, but essentially a lot of times, yes, if the calcium is being pulled out of bone and teeth, it usually is going into tissue like hair and things like that. And if it's in the hair, that means it is definitely hammering the thyroid.
Okay. And so what can we do to reduce that?
So one thing that a supplement that I use is called MK7. It's vitamin K.
Okay.
It literally is, and you have to be careful with it because, if you're like on blood thinners, you can't take it because it can have that blood thinning property. But it essentially latches onto that calcium and it shoves it back. Like I said, calcium, it's not very smart. When it gets out, it doesn't know how to go back. So that's essentially what I use. And depending on how bad someone is, but a lot of times I have to get aggressive. So on a hair test, a normal number I like to see is around 63. Above that means, obviously it's elevated. The majority of the women that I see, we're talking 300, 400, sometimes 500 or 600.
Wow. So that's,
that is aggressive. That is extremely high. Your thyroid will have a really hard time functioning with a calcium level that high. And actually, when it gets above like 150, 200-ish, we actually call it a calcium shell. And the calcium, it's a shell. It like literally shells around things. And that's a scenario where you're at high risk for arteries clogging. You're at high risk for kidney stones, all these things that calcify. People get a lot of joint pain, muscle aches, and things like that because it's everywhere.
Yeah, that was my next question was how are there symptoms? Like, do you?
Yeah. Usually a lot of the people that I see that have, when it's that high, they're the ones that are telling me, first of all, they're extremely exhausted because their thyroid's not working very well. But they have a lot of like joint aches, pains, muscle pains. Sometimes, they're dealing with like, they're told like, oh, I think you might have a UTI. And it's like, oh no, it's because you have like, you're getting the beginnings of like kidney stones. A lot of bladder issues and things like that goes with it.
Wow, that is really interesting. And so I guess, I mean, that's the sort of thing that you really need to be working with, a health professional on. Yeah, for sure. Yeah. I know. How often do you recommend having your clients having the hair mineral analysis done? Usually, I think I've had one done probably about 15 years ago. I know I've definitely done it, but it was a long time ago.
Yeah. If you're working, actively working on it, then I usually, because you can change those minerals pretty quickly. So 3 to 4 months-ish is around what I usually recommend. Once you kind of get it stable, like for me, when I was first testing myself, I was doing it probably every 3 to 4 months. And then now I'll do like once every 8 months, maybe 12 months a year. I just redid mine. And so, but kind of like in that beginning phase. Every 3 to 4 months, because you can change it. You can change those things pretty quickly.
Yeah. Well, it's like getting the blood test. I often say, get your blood test done fairly regularly because then you can see, what I'm doing is working, what I'm not doing. Yeah. You can, I like to, maybe that's that where I use that liking to be in control part of the thyroid personality to stay on top of it. And so
stay on top of it. Exactly. And that's, and that's what I usually tell people. I'm like, you should be getting your blood panel every 3 months or so. So do the hair test at the same time. Like they're both like, they're so important to do.
Yeah. And so just for those that have never had a hair test, what's involved? I mean, I know what's involved. Well, I think I do. But what's involved? You don't have to shave all your hair off, or what do you do?
Yeah. So you actually have to like cut hair in that. The hard part, this is the hard part. And I can vouch for this because, when you have hypothyroidism, you usually have very thinning hair. You have a lot of thinning hair falling out. So sometimes it can be a little bit anxiety for some women when they're like, I physically have to cut hair off. You're not cutting like one big hunk. Usually I just have people cut like a whole bunch of little sections, kind of down lower because you won't even notice it that it's gone. But you use about 1.5 inches from the root out. You use that 1.5 inches of the hair.
I don't think I've got that.
And that's what, and they do like my husband has like, no hair. He wanted to do the hair test. He was just curious. He does not have long enough hair. So you can use like axillary hair. I have men do axillary hair. I mean, like it doesn't have to be hair on your head. But it does, you have to kind of skew numbers a little bit when it's not the hair on your head. But it is better to get a little bit longer of a sample. And essentially it's because every 1/2 inch is a month of hair of analysis. So that's why they request an inch.
I see. Okay. So if I was going to do it now, I'd wait till I'm just about to get my hair cut and then save some from the hairdresser.
That's exactly what I would do.
That would be eeasy for me because it's getting thrown out anyway.
Yeah, exactly.
Yeah. Okay.
Yep.
I think when I must have had it done, I would have had longer hair.
You probably did.
Yeah. And so aside from calcium, are there other minerals that show up in this hair? Like what else can impact on the thyroid?
Calcium, when it's high, it can slow the thyroid down. Potassium is a really big one
Okay.
that it also looks at. Potassium is also needed for good thyroid function. It helps with thyroid hormone conversion. It helps with sensitizing thyroid hormone, period. Potassium is really needed for this. And the pattern I usually see is really high calcium and bottomed out potassium. I see it very commonly. On the hair tissue mineral analysis, we actually look at significant ratios. And one of the significant ratios is they analyze calcium and potassium as a ratio. And a lot of times it's extremely high because calcium is high, potassium is low. So that ratio is extremely high, which is a red flag for a slow thyroid. So I'll see that really commonly. And then selenium is another one that it looks at. And selenium is notorious for, being low on someone with a slow thyroid. Again, it's needed for thyroid hormone conversion. And it's rare for me to actually see it at a normal level. When the women that I'm working with, it's usually bottomed out. And so that's essentially a really important one that I have people work on too. Yeah.
And is eating a couple of Brazil nuts a day enough?
Yeah. So for some, they can just do a Brazil nut and they're good enough. I know I have a lot of people that they do that every single day and it's actually enough. You can definitely get it from that. And I have some that their stomachs are so tore up. They just have really bad gut health. And they are having a really hard time absorbing the selenium out of the Brazil nut. So I actually have to have them supplement with it for a little while. And then eventually they can use Brazil nut. But the Brazil nut is a great way to get it.
Yeah. I remember years ago when I first started, I wouldn't say I'm probably diligent enough to be having a Brazil nut every day, but I remember when I first years ago heard about Brazil nut selenium thyroid, I think my gut health wasn't good and I just couldn't digest. Well, it just felt like Brazil nuts sit well in my tummy, so.
Yeah. And a lot of people with Hashimotos, they have that autoimmune, like inflammatory response already, always kind of going. And so sometimes just eating nuts in general can really cause inflammation. They don't do well with it. Yeah. And that's a scenario. A lot of my Hashimotos, I'm like, let's just do the supplement. I just want to negate the chance of causing any issues with you having Brazil nut every single day.
Yeah. 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 Yeah, that's good advice. I know certainly for me, it's just varied according to my gut health, really.
Yeah.
And my gut health is good. I'm pretty good with nuts. When it's not, I have had periods where, and certain nuts like Brazil nuts, cashews, no good, almonds, okay. It's just a lot of trial and error.
Yeah, it is a lot of trial and error for sure.
Yeah. And so from a potassium point of view, I mean, just off the top of my head, I think bananas are high in potassium. Is that right?
Yeah. Yeah. And actually some of there is potassium in it, but the higher potassium are things like starches, like sweet potatoes.
I love sweet potatoes. Yeah. Okay.
Butternut squash, acorn squash, coconut water is huge with potassium. Another one that I really, really like is I actually have people make potassium broth. So like people make chicken broth, you make potassium broth. And
how do you do that?
Yeah, I can send you the recipe. It's really good. You use a lot of different, you can put a bunch of different vegetables in it, but the hallmark one that's in it, it sounds crazy, it's potato skin. So you peel potatoes and you can put the potato body in there, but you don't need it. It's the skin that has a ton of potassium in it. And I will have people make that and then they heat it up and they can drink it all day long. That's a really good way. Celery juice has potassium as well. That's another one.
Yep.
I can't choke down celery juice for whatever reason. I don't know.
Yeah.
I wish I could because it's so good for you.
Yeah, it's good for me. Yeah.
Yeah, but I have people use that all the time because keep in mind, you need about 4,500 milligrams a day of potassium, just normal function.
Okay.
That's every single day. If you have low potassium, you need a little more. So like a half of a cup or 1 cup of sweet potatoes is about 500 milligrams-ish of potassium. That's a lot of cups of potatoes to eat in a day to try to get 4,500 milligrams. So that's why a lot of people, I do say, okay, you have to get your potassium foods. But if they're really deficient in the hair test, we do end up having to supplement them with a little bit extra potassium, because it's going to be hard to get that amount of potassium.
Yeah, that's a lot of deliberate potassium eating.
Well, which is why I actually have them let's do the potassium broth. Let's get some coconut water, do drinking things, because then you're not having to like eat all the carbs and all the foods to get that much. So usually giving them, some liquid type of potassium is good too.
Yeah. Yeah, that's great. Yeah, I've never heard of potassium broth. So
it's really good. I'll share it with you. Yeah, I'll share it.
Awesome.
Yeah, it's really good, and it's super, super easy to make, and you could make a ton of it.
Yeah, and it's just like a broth, so you can add it to your cooking or drink it straight. Anything
Absolutely.
Like that.
Yeah. And add in, like, if you want to add in like your own spices and herbs and whatever to doctor it up to your liking for taste, you can do that.
Yeah. And can you add protein to it, or do you just have it?
If you want to make it, if you want to put protein in it and make it like a soup. Yeah. Totally can. Yep.
Okay.
Yeah.
No, you got me thinking now.
Good stuff.
Yeah, that's good. And that's what I think the food side of things. I love food. I sort of started in this space as a food blogger. I've written a cookbook, so I like all of that.
That's so cool. Love it.
The foods. I just like to eat. I like to eat, so I think that I like to cook.
Yeah. Me too.
Yeah. So I like those practical, and lots of practical things, because we need something practical, don't we? Like, I think that positive and practical, that's sort of my little, I like to think that what we're doing here it's positive. And actually that probably leads into maybe a quick question about mindset, and then we might wrap it up, because I'm sure we can get you back another day and for some other things. Yep. Yeah. So I know one of the things that you like to work with your clients on is mindset, and it's a pretty core part of the way, it's one of the core pillars, I think, in managing thyroid health is
Absolutely.
mindset. Yeah.
Absolutely.
So how do you work with someone who is in that negative thinking spiral, and it's beating themselves up all the time, super self-critical? Yeah. What do you do? How do you help them?
So one of the things, first of all, they end up getting a lot of action tasks. I give them a lot of homework, we'll say it like that. And it's a lot of, I ask a lot of questions. So I can really dive into, how negative are we beating ourselves up here? How much are we really doing this? And when I see a pattern where someone really has pretty bottomed out, they're pretty negative, beating themselves up pretty bad, I will literally make them fill it out every day. I will make them fill this out every day so that they can start seeing, like, repetitively doing it, like, oh my gosh, I'm saying the same thing over and over of how much I hate my body and how much I hate my thyroid and all these things. I want them to see it. I need them to physically see, like, how much negative talk they're doing. So that's one way that I do it. The other thing too is I actually make them write out a gratitude list and affirmations, and they have to send it to me on a daily basis for a couple of weeks at least, because I want them to show me, like, what is something positive that you can say about yourself, and what are some gratitude things. They have to work on those. One thing that I noticed with a lot of women, and I can vouch for this, I went through this myself, it's really easy to beat yourself up and hate your body and all those things when you have no gratitude. When there's no, okay, so I don't really like my thyroid right now, but man, maybe I should be grateful for the part of my thyroid that actually is working. Or I don't like that I can't lose this weight, but maybe I should be grateful because my body's doing that for a reason, to tell me that I actually need to fix my eating. It's really bad. So I have them kind of turn things around to look at what are the positives that we can look at.
Yeah.
Because the focus has to get off that negative.
Yeah. Or or if they don't, what's the consequence?
So something that, and it depends on the person. It's very person specific. Sometimes I do have to be like, put my foot down. You know what? We're not moving any further. We're not even going to do the hair tissue testing. We're not doing anything until I see some changes here in this negativity, because I can't help coach you and I can't help you work through like what we're analyzing with your hair test or your hormone testing. We can't really work on that until I see some changes. So I have had a couple scenarios where I've had to be like, okay, you know what? We're going to hold right now. We're going to try to work on this mindset thing. We're not doing any testing, anything else until we can get this mindset stuff to shift. And I will make them every day. Like, I need to see consistency of emails, or we're just going to keep pushing this back. How long do you want to push this back? I've had to put my foot down only a few times, but it does work if I've had to do that, because they start seeing like, you're right. I'm not going to be able to fix anything if I don't change this mindset first.
Yeah, it fits into that, because that negative thinking creates stress in your body, and stress creates inflammation.
Absolutely.
And that was the conversation I had recently with Justin Janoska, all about stress and trauma and how that blocks thyroid healing, and so it's all tied into that. And he says, really, unless you're going to deal with the stress, everything else you do is not going to work. I mean, that's really simplified, but that's a core. But that's really what you're saying here.
Absolutely true. It absolutely is true. And to constantly keep creating a stress response. Well, anytime you have stress, I don't care if it's a stress from a food that you ate or a stress from because your negativity, you're going to keep slowing your thyroid down. Your thyroid it's your master gland. So it's like, it's not going to do what it's supposed to be doing when it's constantly getting beat up by negativity or stress or things like that. So if I have to throw in, sometimes I'll throw in, okay, we're going to actually do, and I've had to do this. We're going to do a consult, and we're going to literally we're going to do a meditation. I'm going to make you sit down and do meditation with me. We're going to do a meditation. I've had to do that. We'll do breath work if we have to. We'll do journaling. I've had to do a lot of journaling with people while they're on a Zoom call with me, so that I see them doing it and they can give me feedback on, what they're writing down, and venting. Sometimes they just need a vent. And so, we've done that before too.
Yeah. Yeah. That was really so practical.
Mm-hmm. Yeah.
Do you have them write their own affirmations, or have you got, like, I know there's no one magic affirmation, but have you got a couple that you find regularly help that you could share with us?
So I do have them write their own affirmations, obviously, to be more customized to them.
Yeah.
But one thing, I do tell them other affirmations. I have a list that I actually send them. Like, here's some ideas. If they're like, I don't know what to say. I don't know what to do here. Yeah. One of the big ones that I always make them include, no matter what, is my thyroid is happy and healthy. I'm always like, you have to say it over and over and over. My thyroid is happy and healthy. My thyroid is healing. My thyroid is working. Those are the ones that I'm like, you have to say it over and over and over. I will say, some people do better with like using an app. There's several apps out there. There's one called Think Up that I love that app, where you can have the list, and it can, you can physically read it, or you can record your own voice. And that's cool. But this is the one that I use for me personally. And I record all the affirmations that I want to do every day. I record my own voice on it. And then I just hit a button and they all play. And then it gives me time that I can repeat the affirmation out loud. Oh, that's cool. I like that. I'll have to check that one out. It's a really cool app. So I typically always recommend them to get that. If they would rather just have it where they read it, they can do it too. But they always have to give me, in the beginning, I'm like, affirmations, I want to see yours. Tell me them. I have to see them. It's part of their action task. And a lot of times, like I said, if I'm really seeing that mindset's blocking them, I won't move on. I'm like, we got to work on this longer. Yeah, that's great. Yeah. I've done similar things. And last year put together, I haven't actually printed them yet, but like a whole set of what I've called thyroid love notes. Yeah. I love that. Basically affirmations, love notes. I love my thyroid. My thyroid loves me. Yep. I think all of that stuff. So I'm waiting for a good printing deal, and then I'll just get a whole lot printed. But love it. Yeah, you're right. And I don't know, you probably can't see, but all up on my little thing behind me, I've got affirmations. I'm a words person, so I've got awesome. Other sorts of affirmation cards, and all around me, I've got my
vision board. It's pretty much all words. I'm just a words person.
Yeah, I love it. I love it.
And words are powerful. Words have
They're
that power of life or death. So let's bring life.
So powerful. Yeah. And that's one thing that I always say, you're putting it out there. So if you're putting it out there, if you keep saying my thyroid's never going to get better, that's what's going to happen. It will keep happening that way. So you have to change that mindset. Yeah.
Well, look, I think that's a fabulous way to wrap up, because it's ending on a high. I think, we're both, if you haven't checked out Angela I'm going to ask you in a sec, where can people connect with you, but do follow Angela on Instagram, because she's very bright and sparkly and lots of fun little reels that I haven't figured out how to make yet, pointing in different directions and dancing and music. And I'm like, oh, this all looks too hard for me. I'll get my head around it soon. But in the meantime, follow Angela for fun Instagram and lots of really valuable information. But is that the best place for people to connect with you, or where would you like people to go if they want to connect?
Yes. So I'm obviously, like you said, I'm on Instagram, and I have a website, angelabrown.org. I have some free guides and stuff on there too. I have a bunch of freebies on there that people can get. They can see like the things that I do and all that stuff.
Excellent. Well, I'll make sure in the show notes and on, my website where I connect all of these things, that all of those links are there. And I think you're at Angela Brown Coach. Is that right?
Yep. Angela Brown Coach on Instagram. Correct.
Yeah. So, well, thank you so much for joining us. I'm sure we've got lots more we can talk about. Maybe we'll do another one down the track.
Yeah, I would love that. Thank you. Thank you for having me.
My pleasure. Thank you. Thank you so much for watching this episode of Let's Talk Thyroid. I would love it if you enjoyed it, if you would hit subscribe and the bell. That would be really helpful. Even more helpful, actually, would be to share it with someone else who you know has thyroid issues or you think would benefit from listening. That really is part of my mission, I suppose, is to spread the message of positive and practical approach to managing your thyroid health, so that people really kind of have more energy to get on with living their life and not just kind of trudging through each day. So spreading that word really genuinely helps other people feel better, live better, be better. The best way that you can connect with me is through my website, which is annabellebateman.com. From there, really, you'll be able to connect in all the other ways. I would love it if you would join my Facebook community group. There's lots of great support there. It's all free. That's just being with like-minded people. But from the website, you can also book a strategy session with me. So if you're feeling a bit overwhelmed, not too sure where to start, then book a strategy session. There's also freebies to download and links to look at my online courses or purchase some essential oils or my cookbook. So that's really the hub, would be annabellebateman.com. But look forward to connecting with you and just being in this thyroid health journey together. Have a great day. Bye.
The information presented and discussed in this podcast is not intended to diagnose, treat, cure, or prevent any disease and should not be used as a substitute for proper advice from a qualified professional.